Welcome, everybody, to Connecting the Future 24. 24 events, and I haven't done all of them. There's been 24 events in the series, plus we've had use case events on top of it. So, and now this conversation I think is very, very topical, and we were talking about this before the event, and there was actually Miss Burton, who spoke on our last webinar, referred me to somebody in the care organization in the UK, and there's a lot of concern about token costs. There's a lot of concern about cloud service costs, and they're starting to look at on-prem open source as an alternative. They have concerns about liability and cost, and we're going to be talking about that a little bit. Ruben.
Yeah, thanks, Jose. I was going to interrupt you there because this is one of the things which, because I am in Silicon Valley in US, living through all these transformations. And one of the things which about 2.5 years ago, I built an Edge AI appliance, and people were asking me, why are you doing that? Because you can go to these big guys and do all that thing. Because if you look at the history of AWS, or if you look at many of these Azure and cloud services and everything, what happened was most of the corporations shifted everything towards them and put everything there. Then the CFOs got to know the bill monthly. I started getting to them. They're like, how do I control? I mean, this is like a set fixed cost, and I cannot adjust. Like if I want to show better profit and all that, and then they had to do that. Then they figured out, oh, it used to be a thing called on-prem services, and you can do an open source. That's how Linux came in. Yeah, that's how Llama from Facebook, Meta came out, and then everybody is personalizing it. So you are absolutely right. I mean, this is going to be the next generation. It's a break point. Do we get to use all these AI and democratize, or we don't because of the cost? Cost is going to be, every organization is going to look at it. Yeah. So that's the right point.
I can't believe I'm still doing that. Thank you so much, Ruben. And I'm just putting you to the side, Ruben, but you're not gone. I'm going to bring on our opening speaker, Bart.
Hello. Nice to have me again here. Thank you.
And I really enjoyed speaking to you a couple of months ago. And actually, it was a post you shared and then you added to it inspired this event. And I think it was a post. There was a video about somebody who encoded, was it an LLM or some kind of model directly on hardware?
Mm-hmm.
And you were talking about the opportunity for Europe with on-device open source AI. And I wonder if you could speak to that. Oh, by the way, you may want to introduce yourself, because some of these people here, before you go into it, may not know you. I know most people know you.
Yes, I have a new way to introduce me. If you go and ask Google Gemini, who was globally the first pushing open source AI in medicine 10 years ago, 10 years, it spits out my name. I've been working in health IT since 25 years, 2 decades in 3 acronym companies like SAP and IBM. Now I have my 6-letter acronym company, Isari. I'm driven with passion to democratize intelligence in healthcare. I was part of the IBM very early stage of What's in Health, learned a lot about customer feedback then, ingested it and started designing the way how I think clinicians need to, or should, or wish to consume or build AI. And you asked me to prepare that kind of opening statement. It's going to be 12 minutes. So you tell me when I should start. So
begin. The floor is yours, Bart.
So Okay. Hi, everyone. So I want to start today with a question that has haunted me for years. And the question is like, what is the most dangerous thing about AI if it's not the AI itself? And if it's not the AI itself, but I think the question is, where do we put the AI? Because right now we are building AI in the same way that we have been building computers in the 1960s. A massive machine in a locked room, a priest class of engineers. IBM became big through that, who operated. Everyone else has to line up with the punch cards, submit their request, and wait. Hopes, prays that the output makes sense. We call them mainframes, and for a while, this was the only way computing could work. The technology was too expensive, too complex, too specialized for anyone but a central authority to own. Sounds familiar? Because that's exactly what we are doing with AI today. We're pouring billions into data centers the size of Manhattan. We're training enormous models on enormous data sets. We are putting capital prices on data so data accumulations follow capital concentrations. And we put them behind an API and a paywall and a compliance firewall. And then we tell the clinician, line up, submit your request, wait, and you hope the output makes sense. The clinician, the person who actually sits with the patient, who holds their hand, who makes the decisions in the middle of the night, they get a read-only relationship with intelligence. They consume. They do not own. They do not build. They do not control. And with every interaction, with every query routed to the centralized model, sovereignty drains away. Not in a dramatic way, in a quiet way, in a cumulative way. Every prompt is a small transfer of context, of knowledge, of control, and those transfers do not reverse, as we know. And this is not some hypothetical scenario that I'm just constructing here for this conversation today. This is happening today. And I'm giving you a few examples out of other industry. Take Lovable, a Swedish startup that is now a $6.6 billion company, 400 million in annual revenue. And half of the Fortune 500 companies use it. And it looks like an independent product because it feels like a platform, but Lovable doesn't own its intelligence. Its core agent, the thing that generates the full stack web applications that you can prompt, heavily relies on Claude Opus and Claude Sonnet. Anthropic's models, that's the core. And here is the painful irony. Lovable taught Anthropic the patterns with every prompt, every workflow, every edge case that Lovable users generated. It flew all through the Anthropic models, and Anthropic learned from that. They studied the patterns, they understood the use case, and they launched later Claude Code. Their own coding product. The student became the competitor. The company that fed the cathedral got crushed by the cathedral. And that's what dependency looks like in the age of AI. The sovereignty is a multi-billion-dollar company in a conditional, is conditional on terms of their services, of the model provider it depends on. And when the provider decides to verticalize, to build the same product, there is nothing you can do. You taught them everything you needed to know. There is another example, Figma, Canva, where all the creators are using tools to create stuff. They have integrated Anthropic Claude. The AI features that feel native in the product are actually a pipeline to a centralized model. And then the company built the creative empowerment with that intelligence. Later, Anthropic launched Claude Design. They learned from the patterns. And here is the uncomfortable truth. The same thing is happening in healthcare. The electronic health record, the clinical decision support system, the AI scribe, they all look like tools. They feel like clinical tools, but the AI inside is increasingly a thin wrapper around a centralized API. The hospital thinks it bought software, but it actually is renting a pipe to someone else's intelligence, to someone else's alpha, as recently has been put into the conversation. And just like Lovable or Figma, the hospital sovereignty is conditional. Conditional on uptime, conditional on pricing, conditional on a data center in a jurisdiction it doesn't control. And lately, it is conditional to the tariffs a president of a country defines. Or it stops having access because the model is perhaps too powerful to share with another country. Every time a clinician uses that pipe, sovereignty drains out quietly, one interaction at a time. This is what we call progress currently. But here is what I learned over the past decade, really fighting for open source in medicine, which hasn't been an easy task. The mainframe model of AI does just not create a technical problem. It creates a relationship problem. It changes who owns the intelligence and who the intelligence belongs to. So when AI lives in a data center and the intelligence belongs to whoever owns the data center, or when AI lives in the cloud, the intelligence belongs to whoever owns the cloud. And when the clinician needs intelligence to treat a patient, they have to ask for permission. They have to route through the API. They have to accept the terms and conditions, the latency, the downtime, the privacy risk, and at the end, the bill, which is increasing because we discussed this earlier in the prep, the token pricing is increasing. Every time a clinician sends patient data to a cloud model, sovereignty leaves the building. This is not metaphorically, this is legally. The data crosses jurisdictions, it enters the terms and services of a third party, and it becomes part of a training pipeline that nobody can audit. And the clinician, the hospital, the patient, they all lose something they cannot get back. And that is control. This is not a design choice. This is an architecture of dependency. And if it's built into our regulatory framework, GDPR, the AI Act, MDR, all conceived around the model of AI operating in a centralized cathedral of computation. The intent was right. We want to protect personal data. We want to safeguard privacy. We want to ensure sovereignty. But the implementation assumes that the AI lives somewhere else, far away from the patient, far away from the clinician, behind a wall that only perhaps the regulators can inspect. What is the wall? What is the wall? What is the wall a problem? Then what is the most sovereign or most private, most compliant way to run AI? Is not, when I say this, it is not behind the wall at all. But if the most sovereign way is perhaps in the clinician's pocket, because that is the shift that is happening right now. Not in 5 years, not a roadmap, it is happening right now. And we will be able to run very, very large language models completely decentralized on a desktop because Apple, the rumors tell, is building an M7 processor with 1.5 terabytes on unified memory. That is enough to run the Kimi model at home, in your own premises, under your control. So I see a bright future. And that shift is really, sorry, I'm losing a bit now. We have crossed the threshold. So where the phone in the clinician's hand is powerful enough to run AI models locally, we can do Scribe locally. These are not toy models. We can write letters locally. This is not compressed approximations. This is full inference on device, offline, with zero data leaving or having to leave the device. And even Jensen Huang from NVIDIA stood on stage at the Computex last month, and he said that edge device will become autonomous and that every PC will have agentic systems, and that we are reinventing the PC, personal computer, in the same way that we reinvented the phone when we created the smartphone. He might be right about the shift, but he's thinking from the ship up. And I've been thinking the other way around, from the patient out. Because healthcare is the shift from the mainframe to the personalized, not just a technology upgrade. It's not about tokens, it's the transfer of ownership. It is the moment where the clinician stops being the consumer of intelligence, if you do that, but becomes the owner. It's the moment where the clinician becomes the builder. It's the moment where the clinician can create, consume, customize, run their own agents on their own device for their own patients without asking for anyone for permission. One of our early users called this personalized care giving. I loved that term. This is what we have been building at Isarray over the past 40 months. I'm super proud that we developed the world's first multi-agent orchestrator that runs fully on a phone. It was crazy to do that, but it works. We don't have the need for a server. We don't put data in the cloud. We have one policy framework instead of 12. And it runs on a phone. It uses 0 tokens. So every clinician gets a personal AI assistant where with each interaction, they increase their sovereignty. They don't decrease the sovereignty. It knows their workflows, it knows their passions, their preferences, and they can build agents that handle documentation, retrieve evidence, perhaps if it's connected to another system. It orchestrates, it does everything what you normally would see with other builds around wrappers of APIs. We are at that moment. And here is, as we said at the beginning, why this matters for Europe. This architecture does not solve a technical problem. This architecture from Edge AI solves a regulatory problem that I've been struggling with for years. When AI runs on a device, GDPR is not a constraint, it's a design feature. When data never crosses the border and never leaves the phone, GDPR is given in that sense. There are other regulations that you will need to take in consideration. The AI Act risk framework becomes simpler because there is no third-party processing chain to audit. The MDR in-house exception, Article 5.5 from the MDR regulation, the in-house exception ruling becomes applicable because the hospital controls the entire stack. Scary for some, but also scary if you leave with every interaction or you leave your sovereignty. The regulations we wrote to protect people from centralized AI are the same regulations that make decentralized AI the most compliant path forward. The intent of the European regulations, sovereignty, privacy, protection, is inherently reinforced when we shift to the edge. It is not circumvented, it is reinforced. But here is what I'm worried about. Europe has the regulatory intent right, but we are building the infrastructure wrong. We keep investing in centralized computers. They call it EU AI factories. We are building cloud partnerships with US hyperscalers. We are building cathedrals again when what we need is a reformation. The reformation happened not because people stopped believing, but because they gained the ability to read the books themselves. Luther did not invent a new religion. He gave people the tools to have a direct relationship with that what mattered. He translated, he distributed, he made it personal. That is what personal AI does for healthcare. Personal sovereignty. It does not replace the hospital. It does not replace the clinician. It gives the clinician a direct relationship with the intelligence he owns. No intermediary, no toll collector, no priest class. And Europe is uniquely positioned to lead, not because we have the biggest models, no, we don't have that, or the biggest compute, no, we don't have that, but because we have the regulatory framework, hopefully the political will. If you look at the chat control discussions in Europe, you understand that some people want to centralize, and the ethical foundation to say intelligence in healthcare should belong to the people who deliver care, not the companies that sell the compute. We have the full ecosystem from chip design with ASML, ARM in the UK. We have edge device manufacturing. We have Infineon in Germany. We have STMM microchips in Holland. We have the whole stack. A clinical workflow that is digitally literate, institutionally sophisticated, that's what we can own. What we need is the connective tissue, the operating system that ties everything together, that lets a clinician here in Berlin or in Manchester or in Barcelona or even in Texas pick up their phone and build an agent for their specific patients, their specific workflows, for the specific hospital. That is what I want to talk about today with the panel. This is not just technology. This is the shift who owns intelligence. Because the question for Europe is not whether we can build AI, but the question is, who will AI belong to? If it belongs to the data center, we have built a new mainframe with better marketing. If it belongs to the clinician, we have built something new, something that scales without cost, something that is sovereign by design, something that makes the clinician more powerful, more sovereign, not more dependent. I've spent years fighting for open source principles in AI legislations, and I've seen how centralization serves certain institutions, interests that contradict the very values I stand for in a liberal democracy. I have come to the belief that the only way to win this argument of today is not through policy alone, but through architecture. So you cannot regulate your way to sovereignty if the architecture takes it away by design. But you can build sovereignty into the architecture itself. And that's what Edge AI in healthcare means. That is what personal AI means. And this is Europe's moment. So looking forward to having that conversation today. I hope I provoked and inspired enough at the same time. And I'm looking forward to talk to Jovan, Alex, Natasha, and Ruben, because this is not a solo mission from my side. This is an ecosystem shift, and it starts with a simple idea and a conversation today. So looking forward, and thank you for your attention.
Jose, you are on mute.
Thank you. Go ahead, Ruben.
Yeah. Again, I think we will have a great conversation about what you provoked there, because I think we are at this point, I think we want to bring the other candidate, but I would challenge a couple of those points. I think during the later after party part of it is some of them you need a lot of data for some of these conversations we need to have, and how do you get to that while we are able to address all of your concerns. Your concerns are quite valid, but then we had to look at it from other point of view. If we don't have enough data, there is not enough intelligence. Intelligence built out of the data set, and the data set comes from this humongous compute, humongous training infrastructure, humongous all of those. So how do you manage between not getting enough neurons to analyze this data, and then you able to personalize the hair? So we will come back to that during the after party.
Go Europe. In the chat.
Go America, because I'm coming from here. So yeah.
And Jovan.
Nice to see you.
Thank you. And Jovan was the first webinar speaker I booked many years ago, and he's really plugged in. I know you mentor a lot of startups in health tech, especially like on the you're more on the continent, and so you've got a background in cloud, you've got a background in privacy for health tech, and I know you've seen the journey that startups have gone through. And I want you to this debate. I know about costs. I wonder if you can comment about this actually, and I'm repeating myself as we spoke about this before the event. This question of I heard from Harris Khan today, and he's the head of the Industry Association for Care Orgs in the UK. He says, our cloud costs are going up, our token costs are going up. It's unsustainable. And some of us are looking at open source, some of us are looking at on-prem. But Jose, I'm like, if it's on-prem, I'm responsible now if something goes wrong, like it was in the old days. So they're thinking about it, but there's this concern from a business perspective. I wonder if you could speak to that.
For this, again, for having me. It's always a pleasure to intervene. It's always nice talks, always nice, very nice guests. As you know, as you also mentioned, my expertise on tech side by background, but then compliance, regulatory, and startup creation, being myself founder, but also working with hundreds of startups. This is really the question that has been there since 2010 when I started dealing with this topic, and 2014 when I started dealing with startups. On-prem versus cloud. Initially, especially in that area, on-prem was the way to go. That's why, for example, when we started building our tools, we chose Hetzner. Hetzner AG is a German bare metal provider, so it's very convenient. It's very not, I would say cheap. Cheap is a bad word, but it's very cost effective for startups especially. But at the end, you spend a lot of time in maintaining, in scaling, in putting different machines together, because if one fails, there could be another. That's super easy with cloud providers. You just click buttons and everything magically works. They give you free tokens, free credits, and they hook you in their solutions. So it's so easy to start and somehow fall in the trap. Bart is here a legend in educating us about open source and traps and human rights and our freedom as Europeans and so on. But at the end, for startups, it's so easy to go into the cloud and use the cloud as the key option. On the other side, in healthcare, which is our domain, we have been talking mostly about healthcare solutions here in the last couple of years, as you mentioned. There are several considerations. Also, geopolitics in the past had really big impact because, for example, Privacy Shield, the regulation that governs the transfers of data between Europe and US. And here, I'm analyzing this situation from really legal point of view because I need to give advice to startups or companies saying this is legal, this is not legal. Not really, this should be right, more right than less right. No, what this is legal, this is not legal. So using a cloud provider transferring the data in US, this is legal right now. Several considerations, but it's legal, it's okay. But we have seen that political instability can create issues because, for example, this Privacy Shield transferring the data, now called the Data Transfer Framework, can be cancelled. And now there is a discussion on cancelling it again. So there is one thing considering, there is a risk related to that. Our political friendship between Europe and US can impact those things, can impact your life as a startup creating a product. But on the other side, in healthcare, also other considerations. For example, there are so many very good scale-ups, big companies now delivering cloud-based solutions, but Compu Group, for example, just to name one of the biggest providers of software in Europe, probably works with thousands of hospitals and clinics. They deploy most of their software on-prem because they have a package. For them, it's easily to install it on-prem, delegate their responsibility, the legal responsibility, and also somehow technical responsibility to some extent. There is always a contract and management and so on. But for them, it's really easy, effective to delegate that to companies, hospitals, and clinics who have their own servers. They're happy with their costs, their management, their IT people. That's also kind of structural thing, but that's how they work with most of their clients and so on. So in healthcare, this has been working, and it allows you to reduce your exposure to attacks, hacks, and also legal issues. But we know that for most of the startups, for most of the companies, this is not something that you would like to do, because in order to manage 50 different installations, you need people, and which means scalability is really at risk. Convincing investors is also then impacted and so on. So there are several considerations, but in healthcare, it's not really an obvious the cloud, for example, is not really an obvious choice.
It's an interesting conversation. And do you notice any trends this year? Because I know you've been tracking this debate for over 12 years. Is this year different? Or is this just me as a marketing person who kind of listens to lots of people and noticing trends?
Well, we are getting again and again the same kind of issues repeated, just with a different flavor, just with different level of perception. For example, this privacy shield, now called data transfer agreement, now everybody is familiar with this topic. So initially canceling it took 2-3 years before really we saw first fines for using Google Analytics, which was really the surface level problem. Now if you mention that, you see that much more people are sensible to the topic. They know what you're talking about and so on. AI Act, for example, we are talking a lot about AI Act, but AI Act is still not in force and still discussed and postponed and so on. So we are talking much more about regulations right now into 2026 than what it was, for example, what had happened with GDPR in 2016 when it was enacted, in 2018 when it entered into force mandatory. So we forget, these transitions, and somehow there is more discussion right now. My perception is that now with AI, it's getting more and more challenging to go on premise. And here Bart can happily, perhaps, prove us wrong, prove us that there is a way to go on premise easily. But right now, when you see, the market, what's happening is, I guess, 99.9% is cloud, relying on those big providers, very few of them, and so on. So competition from China for us is perceived even as a bigger risk. So even if it's kind of on-prem, people are reluctant somehow to use software coming from there. So there is a trend, but there are more perceptional risks. So somehow I feel mixed situation, different situation.
I think one of the observation is, I admire the Europe's drive for, as you said, GDPR earlier, and the privacy, and advocating for all of them are amazing, and it is important because it's interesting to see how things are getting so much kind of bad in US. All the data people are stealing from all the news organization. Everybody's data is getting used by others without not paying, or even no privacy, some of those kind of thing. Where I want to ask European, the ecosystem and developers, and like Bard is leading some part of it, is to address it early rather than wait and go through this regulatory argument for 3-4 years, because somebody else is going to sneak in and do things not right way. So we need to figure out a way of overcoming this quickly, rather than keep analysis paralysis and taking time to do those kind of things. So whatever way it can be done, so if it can be addressed upfront early, I think that will give a lot of people early confident, as well as there are enough researchers, enough intelligent, so many good universities. How do you get them to create these kind of models, rather than relying on Chinese model or US models or other models? Those are the things. The conversation should be helping them identify, rather than just throwing a problem and say go and solve it, and say, hey, start doing some of those things. Yeah.
Well, if I can add here, I think we are lazy in principle. We as efficient, lazy/efficient. I mean, startups, for example, just to mention startup as something that starts small, tries to scale fast, and so on. They will take cheap, free stuff as much as possible. They will use Anthropic, AI, and so on. They will care whether something is legal or not. It's a bit cynical, kind of, lazy, cynical, how you want to call it. But basically, using AI, US AI now is fine from legal point of view. So they will use it. They will go ahead. Today, there is a news that Anthropic got 1.3 billion euro fine for copyright infringement, which means that Anthropic doesn't give a damn about our copyright, privacy, and so on. They will do everything with the data we give them. So we have, I think, plenty of proof that they are not really respecting our privacy. So, on one side, we are doing things, we go fast, we rely more and more on those providers, and it's legally okay. On the other side, we have more and more evidence, starting from Snowden, which was the first, kind of light in the dark here, showing us that they were spying on us, treating us really badly, our friends, partners, so on. And now with all the AI that scanned all the web, stole our content, and so on and so forth. So, it's like balancing those two things is important, but how to do it?
A major source of the European Commission's funding is finding American tech companies now. And it's collected from. Sorry, I'm changing the subject. Do you mind if I put you on the side and bring you back in about 15, 20 minutes? And Alex, you've been waiting patiently. We have two more speakers. Alex, thank you so much for coming. And you provoke so many questions, so many things that you've said. I think it was I interviewed you about 6 months ago when you were talking about how the NHS is, well, you weren't saying that, but you weren't saying the NHS, but how policy and procurement, especially procurement, is changing the way they evaluate, and solutions on a more kind of like long-term basis. And I followed up with so many people in webinars and videos when I was interviewing them, things that you said. So that was, so you've had a long tail of influence in the conversations I've had. And I'm wondering if you could comment on this on-prem open source versus cloud debate. I'm not asking you to represent the organization you work for, but from your point of view in terms of policy and procurement.
Thank you, Jose. That was I'm very, very humble and privileged to be part of this conversation, and of course to learn from the other fellow panelists. Thank you so much. Let me first introduce myself to the public here. So I'm Alex Hernandez, Alejandra, for those who speak Spanish and who are keen to trying new pronunciations. I'm a strategy, policy, and transformation leader. That's how I like putting my label, if you like. I like working and enjoy working in the intersection between digital innovation, population health, and system change. Where I'm coming from, what's my hat? Most of my career I've been working in the public sector. So that's normally where I'm coming from. And in that instance, I'm going to give a couple of reflections here. Where can I start? First, before coming to your question, Jose, I would love to make a start with the comment that Jovan shared before. Being lazy, cynical, we can put different labels. From a public perspective, I say people being practical. We do what we can. We all have agendas. We all have specific objectives, and we need to reach a couple of goals. We do it in the most cost-effective way we can. Of course, there's a lot of ethical, basis and values and so on, but we all need to pay our bills and we all need to make it cost-effective. So I would start by that. There is a lot of reflections that I got after listening to Bart in terms of there's a relationship problem. So Bart inspired us and invited us to reflect on who owns the data center. I think that most of the people here, we think, what is the answer there? Who owns it? Someone else? We are being stressed. There's a lot of trust that goes in there, a lot of concerns in terms of what is the unknown. Do we know what is the unknown or not? We are discovering as we go along. There is a relationship problem, and I'm very happy to hear that more people is now understanding it. We are putting together different agents that pursue different objectives. So of course, we are getting more into a relationship with private suppliers, but we, as I said, public organizations, public officials, governments, you name it, we are together working towards probably the same thing or working towards something, but we come from a different perspective. We are pursuing different things. We have different ways of judging, and hopefully, like Bart say, this is being clarified or hopefully guided in a different way through regulation, through these new frameworks, and hopefully through different way of information governance. So I'm going to speak from a UK perspective and sharing just a couple of reflections. Information governance is rebuilding and reshaping as we go along. There is a massive debate here within the UK into who needs to guide this information governance. Is this needs to be centralized or not? So we are moving along and evolving into this discussion around what are the things that we need to keep really clear. Again, the new rules of the game around this new updated relationship. I feel from what I have seen, you have spoken around my experience in procurement, reviewing how the companies and the suppliers present themselves to governments, looking to have commercial relationships. I've seen that there is a gap in there. Who is guiding those things? Procurement people, we are evolving as well, right? So there is no definite information governance. There's no definite regulation. We are moving along with it. For me, it was really clear to see in procurement bids that I was reviewing. Oh my God, you can clearly see the different principles and the different mismatch, the massive mismatch in principles, values, and coming back to this being cynical, practical, lazy. It's just a different way, right? Putting together those agendas, there's need to be a constant evolution. Bart also shared a very good inviting question. Do I see a bright future? I'm not sure about that. I am a pro-techie person and I'm very excited to see innovation. There are many ways in which we can still use innovation and get benefit of it. We still need to perhaps hang in there and see how this information governance and the rules are evolving as we move along. I'll stop in here. Jose, tell me if I have more time or I give the microphone to someone else. You're on mute.
You're on mute still.
I was visiting the LinkedIn Live, and I muted myself while you're talking, so the camera didn't interrupt you. I wonder if you could speak to the concern about the liability and the expense of managing on-prem. Is that something that people are more excited about or interested in this year than they were previously? Is that something that's evolving? Maybe I shouldn't be asking you that because I'm asking you like inside baseball information. Maybe I shouldn't be doing that, Alex.
What I have seen, there's no definite answer. You find pockets of everything. So it's so disparate, the appetite, the risk appetite, and perhaps the level of safety, if you feel that people perceive. I cannot comment. I have found all sorts of pockets within the UK context around how organizations are trying these different risk mitigations, different risk logs. You find people that it's a super, champion of, we don't know, it's uncertain, governance is still evolving, but let's go with it. Let's just go with it and make a start, and then we move from there. This word of being agile, it's really popular, right? How agile do we want to be? Well, it depends, right? It depends on the moment. It depends on your agenda. It depends on the people around you. So that's evolving. There's no definite answer on that. I'm happy to see that. in that sense, I do see a bright future. It's fascinating to see how different people are, engaging in this topic, engaging with the sovereignty, engaging with uncertainty. It's fascinating. At the same time, it is scary. I come from a population health perspective, as I said, and that just scares me. The level of trust of people do change. I do feel that there are pockets of ownership developing within the clinician base, like Bart pointed out. But I do feel that there are other pockets of clinicians, teams that are really scared of what is happening, that are really scared of see this information governance being still unclear and being raising things around clinical safety concerns all over. I don't think that's going to stop. I think that's going to keep evolving. And that's why it's so important to keep talking about trust, engagement, values, and this relationship that is evolving between the different organizations that have different objectives. But there is definitely need for someone who plays a role into challenging not only your own perspective and your own background and the people around you, closer to you, but also to challenge everyone, right, from multiple disciplines. So definitely these conversations are needed. Thank you for putting this topic in the table.
Thank you, Alex. I'm going to bring you, and thank you so much for coming today, Alex. It's great to see our final speaker. And let's see if I can, last but not least, Jasper. Thank you so much, Jasper. And he's joining us from Texas?
Dallas, Texas.
And actually, Bart was speaking to it about, and you actually were speaking about it to me yesterday. I think we spoke yesterday, or no, the day before yesterday. Sorry, it wasn't yesterday. And about models, foundation models. I shouldn't say learning your things, learning your processes. And I wonder, first of all, if you can introduce yourself, because I know you wear lots of hats. And I'm wondering if you might do a better job introducing you than I will. Do you mind?
No worries at all. Well, first, thank you so much for having me. I really do appreciate the opportunity to join such a star-studded panel. So, hi, everyone. My name is Jasper Cannon. I'm the managing partner of Chesterton Hills. We are growth specialists. We help startups and innovative organizations grow. So that's through partnerships, business development, expanding both domestically and internationally. My team and I have helped companies expand into over 30 countries, obviously into the US, but also into EU and Latin American and some Asian markets as well. So we do that. And then we have another side where, if you're looking to get investors in your business, we won't do capital raising, but we will help you craft your story, craft your narrative, create the pitch deck, bring in advisors that are both generalists and specialists, and really get you kind of ready for prime time so that you're ready for any kind of question an investor can throw at you. And when we're doing that, we're connecting you with our capital network, and we say, hey, is this somebody you would want to talk to? They opt in, and we set up the meeting, and then you're on your own. But yeah, so I do that, and then I do venture things for a number of VC firms, most prominently MedStarter, where we fund and accelerate healthcare. And at Chesterton Hills, we run the range from, we say anything but crypto and cannabis, but I would say about half of our clients are in healthcare or life sciences. And that's initially kind of where I got my start. So it's where the deepest part of my background is.
I'm wondering if you could comment on this question that Harris Khan put to me today, is balancing the concern about rising costs and of cloud services, of tokens, versus concerns about responsibility and management of managing something on-prem. And it's almost like it's apples and oranges. Because I know if I go with cloud services, if I go with tokens, I know how much that costs, even if I'm not happy about it. The cost is going up, but it's like, Jose, I'm looking at this other thing, but it's messy. I don't know the cost of how much is it going to cost me to manage an employee who's going to do all these things? What's the responsibility I'm taking on? And what kind of advice would you give to somebody who's kind of looking at the apple and the orange, and they're trying to make a business decision between the two?
So a few things. My fellow panelist Bart hit kind of the intro part of the question very well when he was talking about drawing the roadmap effectively for these frontier models. I actually wrote an article about this last week, and I'd been working on it for a few weeks. But I speak a lot about data and AI, and I think part of the conversation we're not having is the very real risk of outsourcing our intelligence to these companies, but also providing them the roadmap. They're essentially, you can count on companies to act in their own best interest, obviously, but they're model providers, but they're not agnostic to the business. You're using them, you're leveraging them, and you're saying, through your queries and through kind of what you're plugging in and the work products you're putting out, you're basically telling them what you need help with and where the goal lies. Because especially if you're using frontier models at the top of the band, right? If you're using, Opus 4.8 or what is it now, Fable, or some of these really higher costs, you're not using those for what's the weather outside. You're using them for really pressing problems, and you're effectively it's a lot like buying shovels from a person who has this large plot of land and you're going to go out and search for gold. However, they have a satellite that looks down and sees and they can tell your activity. And when you get gold, you run around and they go, oh, okay, that's where the gold is. And then they show up tomorrow with an excavator. And these investors who are putting money into these model companies, I mean, speaking myself as an investor, I'm not looking for a 1 or 2x return. That's nice, that's fine, but you don't burn $100 billion plus on the altar of a chat window. You burn that much because you're looking for something that's going to transformationally, revolutionize how business is done, and that's not a chat window. That's okay. To Bart's point, and to the point I also made in the article, that's okay. Now we're launching Claude Design, and it was way closer to what it was way more advanced than what Canva and Figma thought it was going to be. And, and that's just one example, but you're effectively providing them the roadmap to where the goal is. And of course they're going to come for that. What were the other parts of the question? I'm so sorry.
The orange. So people are balancing that risk with this other risk of on-prem, which used to be familiar.
Yeah.
But now is unfamiliar because of the distance of time. In terms of, so they're trying to consider these two things. And it's like, oh, we used to have everything on-prem, but we're so not used to that now that it's almost like we're having to balance the risks of that with the risks of going, like you described, stealing our IP, and this long-term uncertainty about rising token costs. So what kind of rubric, what kind of yardstick do they use to kind of, when they're evaluating those two sets, and they're going to be thinking about that, we're going to be featuring them a lot over the next year, balancing those two risks out.
Yeah, I mean, I'm not really involved much in the on-prem side, so I'm really going to focus on the token cost. I mean, so on the token cost, I kind of touched on it a little bit earlier, but I think one of the things that has provided somewhat of a sense of schadenfreude to the public at large is the this kind of push of like, oh, we're going to use AI and we're going to mass layoff, or we're going to not hire as many people, both of which are happening, no matter what the All In podcast says, has been that in a number of cases, the token cost is outweighing the cost of what an employee would have been. Or, you know, there's kind of this real problem with companies. Some of them were doing this initially. I know it's kind of died down a little bit, but we're doing like token usage leaderboards. And obviously that incentivizes some good behavior, but that incentivizes a lot of very bad behavior of, you know, using the top end of the model to ask the weather. And so I think there's the challenge of, you know, you want to be sure you're leveraging the technology, but to steal kind of a medical phrase, you want to be sure you're using it at the top of its capability, right? And in the doctor's case of like at the top, practicing at the top of your license. Hopefully you're not having an MD like apply a bandage, you know? So when you're talking about usage costs with these companies, you want to be sure that you're using the correct model for the correct thing. And there's some kind of some companies I know are coming up with kind of what would you say, like bespoke routers almost that look at what you're trying to do and will say, oh, you don't actually need to use Opus for this, and we'll kick it to Sonnet or some other kind of lower cost thing. There's a lot of opportunity as well for startups to start to really help companies be truly model agnostic. Because there's a lot of challenge where, you know, you're working deeply on something in Claude and all of a sudden you hit your usage limit for the week at the $200 plan. And you're like, okay, well, darn. And now you need to switch over to, you know, ChatGPT, or you need to switch over to Gemini. And that conversion of like, okay, now distill this down and give me something that I can put in that, it loses a lot of context. So I know a few people who are doing those kinds of things, but I think for organizations, you're really going to have to decide at a organizational level, how are we going to approach these technologies? Where are we going to leverage them? What are we going to leverage them for? How are we keeping humans in the loop? Because at the end of the day, these models still make up things. They hallucinate. They outright fabricate. Like there's been cases where lawyers are using what is probably ChatGPT, and it's generating fake cases. I've seen a number of those, and there was a report that was done by a major consulting firm that the Australian government, whacked them publicly for. Hey, these exhibits and things were not correct. So, you got to figure out, okay, where are we using these technologies, and how are we, as an organization, incentivizing the kind of best behavior, and how are we putting guardrails around where we don't want technology to tread, right? So at Chesterton, we use AI, of course, but we don't outsource our critical thinking to it. We don't use AI for a number of things. Actually, like talking to clients, I'm not using AI to write the email. Actually, like reaching out to like our capital network, absolutely not. Intake, like there are definitely things where I'm just not doing it. Now, generate meeting notes, of course, right? But there are certain areas where having the human touch is significantly impactful. A quick example is, so if you ask somebody what a doorman does, so they're going to say, oh, well, a doorman opens the door. Yes, but no, right? A doorman opens the door. They say, hello, good morning. How are you? It's nice to see you again, Mr. Johnson or Mr. Patel. They also provide a level. So there's that customer service and human connection, right? They immediately class up the place because that, places that can't afford doormen or aren't don't have doormen, right? They also provide a measure of security. And if you just said, well, what does a doorman do? Well, they open doors. Well, replace the doorman with a sensor. Yeah, but no, like you're losing out on a real element of the human touch. And so where that dovetails back to the usage cost of, as an organization, you make a choice. How are you going to leverage AI? And some organizations and leaders kind of worry about, well, what if we pursue this initiative to use these technologies and people don't like it? Okay, what if you make the decision to not pursue those technologies? Like pursuing technologies and trying new things and trying to be innovative, right? Not in the sense of like, oh, let's do new Coke and change this to something that is objectively terrible, but can work out really well. But also stagnating can backfire just as badly as trying a new thing that people don't necessarily love. So, I think you gotta make a choice, and then as an organization, you gotta decide like what you're rewarding. Are you rewarding usage or are you rewarding innovation? Because I can, if I wanted to, I could spend easily $1,000 in tokens by the end of the week, no problem at all. But is that actually moving the needle for the business? How is it? Like, how are you tracking that? Like, what is the measure? And I think right now there's this race to, throw money into the boiler at the engine room and hope that it propels the ship forward. Like, okay, yeah, sure, maybe. But if the conversation was around, we have to use AI, not where should we use AI, not how can we leverage this, but we have to. If executive compensation is being tied to the usage of AI, not the proper, utilization of AI, but just using it. If Wall Street and markets are saying, if you don't use AI, if you don't mention it 72 times in the first 15 minutes of the phone call, we're going to revise our forecast and your stock's going to tank tomorrow. Seriously, listen to investor calls or any announcement from Microsoft, Apple, any of the major companies, and supercut it to saying AI, and it will be 2 minutes of just the repetition of the word, right? And investors, we kind of have people come to us and they'll say, oh, we're using AI, and then you dig into it a little bit and it's like, oh, you're not actually using AI, or it's yet another ChatGPT wrapper, right? So it's really a conversation around not only the responsible usage of AI, but also the incentive structures behind it. Are we rewarding, use it at all costs, darn the token bill at the end of the month? Because that's how we get situations like a number of months ago. I forget. I want to say it was one of the major companies. I want to say it was Oracle, I think. But they had gone through their entire yearly budget for these models in April. That, some of that happens because who knew shiny, right? But some of that happens because of organizational pressure. And so decide from an organization standpoint, how are we going to use these? How are we going to leverage these? How are we going to teach and train our people to be responsible with these things and to leverage them at the top of their abilities for the top of their needs? But also, what are we going to incentivize? Because the incentive structures, not only with these technology, but in healthcare in particular, I'm sure we all know, what you incentivize is what you get. If you incentivize fee for service, you will get more of that. If you incentivize, over usage, you'll get.
I think we got a similar debate. Well, a lot of things you touched on in my conversations with people in marketing. So they were talking about this position a lot, and I don't want to sidetrack the conversation, but there's a consensus about not first contact, but the annoying things in the middle where people don't get served, they don't get the follow-up call, they don't get this, they don't get that. Use the AI there to automate all that and not first contact. And it goes down to the incentives, because if you incentivize the marketing or sales team on touch points, then they'll use AI to generate lots of touch points at the very top of the but I'm going to bring on everybody. Alex, you have your hand up. I'm going to bring you on. Thank you so much